My name is, oh, I'm echoing a little bit.
My fault.
Put yourself on mute.
Hopefully everybody can hear me okay. I am Chris. I am one of the certified peer recovery coaches for the Washtenaw Recovery Advocacy Project, or the RAP team. We're an RCO underneath Home of New Vision. Some of the duties that I perform as a recovery coach is I do a lot of volunteer coordinating. I do a lot of event planning for different events in the community, and I do a lot of different engagement in the community. So those are the kind of the three main things that I do personally as a recovery coach. Today, I'm going to be speaking. My portion is about what an RCO is, as well as kind of how they're formed, mostly the basics of an RCO. And my counterparts for the presentation, Ricardo, Sarah, and Deb, are going to speak more in depth on some topics that explain why an RCO is important to the recovery community, as well as the community in general, or as a whole, I should say. So if you guys wanted to, there you go. So the first stat that I was going to get into is the overall big picture, in that nearly 22 million Americans suffer from addiction to alcohol and other drugs. It's the #1 cause of preventable deaths. So that's way larger than car accidents, DUIs, all that stuff, right? It's the #1 cause of preventable deaths. And that's the biggest thing that we are trying to accomplish is prevention, right? To keep people from suffering any longer. And it's just a good reminder that there's 22 million. That's a giant number, right? So that's kind of the biggest thing, that the overarching thing. Like I said, I'm going to speak a little bit about the history. So this is just a brief history about RCOs in the past, how they were kind of formed, and where it came from. So much of the history of RCOs, the recovery community organizations, can be traced back from the 1970s. And I really like this first beginning part, because what I was reading is that it was formed after a lot of these grassroots movements. So they formed after seeing successful movements like civil rights movements, a lot of LGBTQ movements, and they took that framework, a lot of these successful movements, and mimicked a lot of what worked. And I think that's a totally smart strategy. You find what works, what doesn't work, and you frame your movement based on that. And it's shown to have a lot of success that way. Some of these people that I'm going to speak about today and briefly go over are very integral figures in the movement. So that's like Marty Mann. If you want to go back actually real quick. So Marty Mann founded the National Council of Alcoholism 70 years ago. So quite a while ago. And that was an education to raise awareness. Bill Wilson, co-founder of AA, testified before Congress that he envisioned hundreds of AAs would fill the halls of Congress so that we would have these movements today. So he kind of thought way back then that we would be to a point that we are at today. And the late Senator Harold Hughes, a person in long-term recovery, founded the Society of Americans for Recovery in 1991. William White and Philip Valentine were integral in providing the language and structure for RCOs, and they were based for Faces and Voices, which is one of the biggest RCOs. A lot of what they did was defined that framework that I was speaking of, a lot of the definitions, and that's really important. I mean, obviously, if we have differing definitions, it's not really going to have the importance of what things are. If we all have the same definition, which is what they did, they developed the language that we use today for RCOs. And like I said, these people sparked this unified movement that we're doing today, which is millions and millions of people all having this one band, one sound kind of voice. And it's impacted a lot of different individuals in recovery, as well as families around substance use disorder. So I keep saying RCO, and diving into the definition of what that stands for. RCO is a recovery community organization. It's an independent nonprofit organization led and governed by representatives of local communities of recovery. These organizations organize recovery-focused policy advocacy activities, carry out recovery-focused community education and outreach programs, and supply peer-based recovery support services. So that's a pretty wordy definition. We're going to dive into exactly what all the specific things mean. But the biggest thing about RCOs, Sorry, I got to keep moving this panel because I can't really see too well. But RCOs, the biggest thing is they help bridge the gap between professional treatment and building a healthy and successful lives in recovery. So it's that long-term kind of assistance and kind of filling those gaps where people aren't getting that in traditional treatment. The three kind of things that RCOs focus on across the board is educating the public about reality of recovery, advocating on behalf of the recovery community, and delivering peer recovery support services. So those core three principles, I gotta move that again. So the core three principles that RCOs function under is having a recovery vision. So sharing that they all focus on the solution of recovery or addiction as the problem, in recovery as the primary goal. So people seeking and sustaining long-term recovery from addiction. This embraces an all pathways approach. So it's not a one size fits all kind of thing. You go ahead. Having that authentic voice. It means that the interests of the community draw from basically the majority of the members and the staff and volunteers are members of the local recovery community. So we are people in long-term recovery, also representing people in long-term recovery. So, you know, it's not people from the outside governing the RCO body, it's people in recovery. So we share the same common interest, the same common goal. And that's a huge component to being an RCO as well. And with that being said, it's also the accountability to the recovery community. So all RCOs are accountable to the recovery community, and as such are subject to being responsible and sensitive to those needs. So with that being said too, is like every community is different, and every community has certain things they may need and that differ from maybe an urban community or maybe you know, a community that's not, you know, what am I trying to say? Basically a smaller population, right? And so some of those needs are going to be different based on those communities. And when we have people that are in long-term recovery governing these RCO bodies, we're able to meet those needs and be able to figure out what each community needs. And it's, we're sensitive to those needs. So you can go ahead, Ricardo. So what do RCOs do specifically? So like I said, they have that public education and awareness piece. We do policy advocacy, peer-based and other recovery support services and activities. We do a lot of fundraising. That's a big way that we stay afloat and stay alive and keep developing and growing, as well as membership development. That's people, you know, coming into the RCO and developing them to be leaders. Other core strategies include recovery research, resource assessment, needs assessment, educational campaigns, and leadership development. The public awareness piece, it takes personal stories, and it talks about addiction, and it kind of takes that personal feel. And when we talk, like I know I specifically do this when I speak to high schools. I go to high schools and I speak about where addiction took me and where recovery has taken me. We share our strength, experience, and hope, right? And that public education piece shows people what recovery is actually like, instead of letting people with the voice outside of recovery speaking about what it actually is. Personal stories have power. So we try to use that to educate the public as much as we can and bring awareness to recovery. And policy advocacy, that's a big one. It's all the way from local to state to federal levels. It promotes recovery. We also try to remove barriers as much as possible. So some of the barriers that come up around recovery is, you know, getting people back on track in their lives, obtaining a job, obtaining housing, which we see a lot of too, and, you know, building those relationships back with family and friends. So our advocacy helps with all those things. We try to do this from every level of government. And that last big pillar that we have is the peer-based and other recovery support services. So this is things like recovery coaches, family support navigators, having phone and web. As you know, Zoom's becoming more and more popular that we're on today. We are trying to always make sure we're on top of that and ever changing. We have different meetings. Like I said, it's important that we have different recovery pathways. So SMART meetings, different all recovery meetings. We try to get into wellness programs, yoga, mindfulness, the list goes on and on, right? And in addition, we have a host of trained volunteers. That's what I do a lot of, as a volunteer coordinator. So you can go ahead, Ricardo. And fundraising and membership, like I said, is a huge way that we are able to have these agencies to be able to keep going, to be able to develop, right? To be able to be self-sufficient and be independent. We don't have outside influences. We are able to be the self-sufficient funding type of thing. And I know Ricardo is speaking more on fundraising, so I won't dive too much into it. Some examples that I wanted to share is just a couple different ones across the country. So we have the APAA, the Association of Persons Affected by Addiction, and that's in Dallas. They were the first RCO to enter into a service contract with managed care provider to provide peer recovery services for co-occurring disorders. So that was the first time we really ever saw that. CCAR, which is Connecticut Community for Addiction Recovery. They were the leader in peer-led services. CCAR has pretty much been a global model for training coaches. So they do a lot of different trainings. They certify people. It's quite a big RCO. And then in Michigan, some of the ones that we even work for, Lifeboat Addiction Recovery Services, Peer 360 Recovery Alliance, the one I work for, which is Washtenaw Recovery Advocacy Project, Recovery Advocacy Warriors, and there's so many more. And that's kind of like we're all in this collection of the MRCC, the Michigan Recovery Collective Community Collective. So with all that being said, those are just some of the examples that we have. And I will go ahead and pass it over on to Deb. So thank you guys for my portion and for listening to everything that I had to say.
Yeah, thank you so much, Chris. That was great information. Yep, my name is Steph Smith, and I am the chair of the board of Lifeboat Addiction Recovery Services in Lansing. We have as our primary organizing structure a recovery community organization that's organized as a recovery community center. And what Kelly told us before, John Kelly, a researcher, he says that these RCCs, these recovery community centers that are recovery community organizations are, in essence, the new kid on the block. Advance. So recovery community centers versus the organization is they're really not that different. A recovery community organization is a collection of recoveries who provide services for recovery, for recovery, so that they can be organized in a whole bunch of different ways, as Chris told us about. A recovery community center, an RCC, is a place where recovery community organizations may operate. It's not the only way, but it is one strategy that can be used, where it's an actual place that recoveries can go and get the services or get the community that they need. So RCOs are like the umbrella over a recovery community organization. With the RCC, with our MRCC, you're going to find that there's so many different ways, but many of them do have a recovery community organization. In this RCC, or the Recovery Community Center, people can come to a physical place and receive services. They can receive recovery coaching, recovery planning, skills training, job search. They can receive advanced police. They can receive medical navigate. Well, yeah, thank you. They can receive medical and clinical services where that maybe the navigation piece. So a person comes in the door, they could be this could be ground zero for their recovery, and they need services. And you'll have recovery coaches there that can immediately start the navigation process, or someone who's having a mental health crisis, and you'll have recovery coaches there who can immediately start getting them into substance abuse care or mental health care. They can also help navigate people into treatment. In a recovery community organization, if you look at one like one of our larger ones in Ann Arbor, which is Home of New Vision, the Home of New Vision, which as Chris is connected with, They are a massive organization, and they have a treatment component with the Home of New Vision, and RAP is able to help navigate people immediately into that program. And if there isn't any beds, they could try a whole bunch of other things. Now, mutual support meetings are also offered there. Mutual support meetings are anything from the traditional 12 steppers, the AA and the NA, but they also can be refuge recovery and smart recovery, or any other type of recovery or a meeting. We're seeing some across the US that are actually taking in some other types of recovery meetings that help people who, you know, maybe like are overeaters, like Overeaters Anonymous, things like that. Advance. The Recovery Community Center is a really great way for recoveries to have an identifiable location to go. During the pandemic, it was a little bit more different because and I know that they, with one of our presenters today, you're going to hear from Ricardo, his group did went on overnight onto looking at providing Zoom meetings so that their Recovery Community Center was a Zoom platform where people could go and get help, was a website. And many of us, we even do that too. But it's a way of setting a one-stop shopping kind of location. So anywhere on the continuum of recovery, a person can go and find their home in a center. And it creates connection. And one of the things that we know that they're talking about right now is isolation of people because of the pandemic. These centers reduce isolation. And they're used as a hub to connect recoveries to other recoveries, not just in your region, but across the state, where if a person's vacationing, they can go and do this activity or that activity, not necessarily in their own community, but a way to connect with other recoveries. They are not all, as I said, they're all along the continuum from those people not yet in recovery to early and eager, and to the old timers with skills and knowledge. So within a recovery community center, there's so much need for everybody. You don't time out, you don't age out in that community. Keep going. Now, what we have to realize is that it's not in tension with a professional treatment organizations. It's not in tension at all with professional mental health care, because those programs are episodic. So if a person relapses or they're seeking treatment for the first time, they don't go into professional treatment, stay there forever. They go in for a period of time, get tools, get medicine, get hope, and get support, but then they have some place that they have to go. This begins with a concrete beginning and a concrete ending. They can last anywhere from a couple of weeks to several months, but they're considered acute and finite. Recovery community organizations have a role outside of that formal treatment. They can provide resources to formal treatment. They can provide activities. They can provide classes. I mean, in our organization, we teach PATH, Seeking Safety, the WISE program, BOTVINS, Prime for Life. We have multiple classes if anybody wants to learn more. We teach Recovery Coach Academy. We teach ethics for recovery coaches. There's so many different things, and there's activities. We have, you know, we're going to be doing a roller skating activity. We're going to be doing a volleyball activity. We partner with other agencies to do outdoor movie theaters, right? So these programs, these recovery community organizations don't just sit in their little offices. They are a hub that reaches out to other spokes. They can help navigate, and they can help create a living environment for people by giving them their formal treatment. And so once they get done with that, so their full and lasting place is the recovery community organization where they can grow. Think about bricks and mortar. Formal treatment forms the bricks, the building blocks to recovery. The building blocks are helped, that they help the recovery understand issues of addiction. RCOs and RCCs, we're the mortar. we hold it all together for people, because we ourselves, the beauty, as Chris beautifully put it, the beauty of an RCO is that we are recoveries. Myself, I'll self-identify. If I make it to September, I'll be 20 years clean and sober. But that's why I do this. It's part of my recovery journey. And so I'm like one of the old cranky old timers, right? Keep going. So we come in all shapes and sizes. So recovery community centers are just but one type of way to articulate recovery residences. Many times you'll have a recovery residence program that'll have a center associated with it where people can go to meetings, they're open to the public. You can have recovery coaching centers where people may come into the center for a moment, or that your workers go out into the community. You can have recovery high schools. I mean, who would have thought ever having a recovery high school? You also have collegiate recovery organizations here at Michigan State. We're in the shadow of Michigan State University. Here at Michigan State, we actually have dormitories that are set aside, portions that are set aside for recoveries. Okay, the workforce is equally diverse. The workforce in these programs is so different. You have volunteers who come in and want to give back to the community. You have individuals who are actually certified recovery coaches. You have others that are the MDHHS peer specialists. You have, as I said, everything from this is the first day of the rest of their life to those who want to just sail out their time in recovery. We are from all levels. I think we missed one. Can you go back? We are from all levels of education, skills, training, and belief systems. I have never met such a diverse population everywhere, from a full faith in a particular denomination or a particular way to agnostic to, you know, people that are searching. I've seen people that are advanced degrees, medical doctors, PhDs, all the way to a person who, you know, still wants to get their high school GED. But people who are skilled trades people who want to get into skilled trades. We offer hope and help, not just through recovery meetings. We know that the meeting often after the meeting is the place where people grow. And so we've taken that concept as recovery community centers and organizations to be able to help people do more than just be in a meeting. Meetings are important, but they're not the whole thing. As it was said by Bill White, with professional activities and are intended to provide flexible community-based options to address the psychosocial barrier to sustained remission. So there's a really big roadmap to recovery. People recover through many different pathways. For as many people stop using harmful substances, we have to create risky situations because of psychoactive substance use. There is a pathway to get to and stay in recovery. And our MRCC, our Michigan Recovery Community Collective, is forging the way to allow Michigan to find that pathway. Conceptually, RCOs are founded on the principle that achievement of sustained recovery from alcohol and other drugs use disorders is not just a function of medical stabilization, like detoxification or addressing psychopathology, but also by providing and successfully mobilizing personal, social, environmental, and cultural resources that can be brought to bear on recovery. The total aggregate of these resources has been termed recovery capital, and recovery community organizations provide that. There's a greater availability of access to recovery capital, and the greater likelihood that individuals will be able to buffer stress associated with adaptations needed to sustain stable remission. Basically, this is the place where no matter who you are and what you do in recovery, you will find hope and help. Okay. Recovery community organizations provide access to many roads. The Recovery Community Center is but one to create local, physical, accessible place for recoveries to gather and offer hope and help to others who need the help. Thank you for letting me share. And now I'm going to turn it over to my colleague, Sarah Derigo.
Thank you, Deb. So I am very happy to be here today and talk with you all about the community support and services needed to operate a successful RCO, or like Deb talked to us about, RCCs. So first, I will introduce myself. I'm Sarah Derigo. I am the program director for Recovery Advocacy Warriors. Can we advance? We are out of Monroe County, Michigan. That's Region 6. So we're down in the southeast corner of the Mann. So I'd like to just speak from my personal and professional experience with how RAW began, because I think that is critical to describing how community supports are so important for RCOs. So we all know SUD and recovery is a community issue, right? And it takes a united community to achieve a solution. So about 4 years ago, RAW was officially formed by a grassroots group of like-minded individuals with a passion for recovery. With the help of a supporting agency, RAW received its first grant to coordinate community recovery focused events in Monroe County. So it started very, very small. We did just 2 events, which was an annual recovery picnic and an annual walk-in rally. Sorry, I have 2 sets of slides and I got notes on my one over here. So Ricardo, can we go back to the other one just real quick? Thank you. So I do want to highlight that the idea for RAW came from a person in our local recovery community down here in Monroe. They had gained some experience working for some local providers and got some training from some other RCOs in another county, which is another very critical aspect of community support in RCOs. RCOs need other RCOs, and we'll get more into that later in this presentation. So the individual who came up with the idea for RAW organized a group of individuals from Monroe who had all been impacted in one way or another by SUD and recovery, whether it was a family member or personal experience, who all had a passion for helping. And they all had different backgrounds, different crafts, different trades, and we will talk more about how each one of those things are critical to the RCO operations. We're also dependent on our community partners. We had a director of behavioral health here in Monroe County, Wendy Klinsky. She worked with Catholic Charities of Southeast Michigan for many years. She supported the RCO model, so she was able to help this individual get this RCO here in Monroe off the ground. We can advance, Ricardo. So understanding your recovery community, like Chris and Deb talked about, it's really important to be sensitive to the differences among communities, because my community here in Monroe doesn't look like the community out in Washington. Our needs vary greatly. So just looking at what services and providers are currently available, what is missing, what barriers does your community have, how can an RCO serve your community? And another great question is, who can help your RCO serve your community? Because other individuals and other agencies and businesses, people are inherently good and they want to help, right? And most of us in one way, shape, or form have been impacted by SUD. So everybody really does want to help. So I'll offer an example for that. I know here in Monroe, one of our biggest barriers is transportation. And I know that is kind of a resounding barrier that I hear from other RCOs and other areas in Michigan, but I've seen some great communities that have you know, public transportation systems available 24 hours or later into the night, and it makes it possible for the population we serve to get to the services that we provide. So being here in a smaller community without access to services like that is a huge barrier for us. So that is something that we are working to overcome. We can advance, Ricardo. So who do we serve in our community, right? And again, Deb and Chris touched a lot on this. RCOs serve individuals in all stages of recovery. We serve families and friends. We serve allies of recovery. And when I say allies of recovery, that could be anybody from your next door neighbor who is just supportive of health and wellness and recovery, or it could be your local printing shop who wants to make a donation to help you with your community events, right? So there is a whole spectrum of the people that we serve. And who participates in our services, right? Our participants experience engagement through, again, I am so happy that Chris and Deb went before me and you guys set the scene and talked about all the different type of events that we do, the programs and services that we offer through the RCO. So engagement through community events, mutual support meetings. Down here in Monroe, we do a lot of naloxone distributions. We're very focused on recovery coach education and just awareness, spreading awareness, whether that's word of mouth or passing out flyers or just being at events. Another very, very, very critical aspect of the RCO and the importance of community support is your volunteer base. Here at RAW, we are a very small staff. There are 4 of us, and you know, we are heavily dependent on volunteers to help make these activities and events successful. But I do want to point out that while volunteers are essential to the operations of RCOs, we simultaneously work with our volunteers to support their recovery support needs, right? So that may be one-on-one coaching with our volunteers and just being able to give back and be among peers and other recovery coaches is a very empowering thing that provides opportunity, connection. There's mutual benefit. And then with volunteers, you never know what you're going to get. You may have somebody who is fantastic at just simply talking to people and going out into the community and spreading awareness about your events, or you may have somebody that is awesome at flyer design or they're artistically inclined. So it's an opportunity for you and your RCO and your business model, as well as an opportunity for them. So that is very, very important. And of course, we have a whole section on agencies here. So I feel like this is a very, it's mutual benefit for the RCO and the other agencies in our community. So they don't just support us, but we support them. So we have agencies of the treatment and clinical variety. This could be crisis intervention center, detox centers, inpatient, outpatient, transitional housing, hospital systems. Other agencies that serve the basic needs of the populations that we work with, anything from food banks, soup kitchens, homeless shelters, domestic violence shelters, even clothing shops, whether those are local clothing closets or places like the Goodwill, Salvation Army, thrift stores. I know that we've had existing relationships with local clothing closets. If some of our participants need clothing, we can give a voucher so they can go and get clothing from the local clothing shelter. And then other agencies that we work with are life enrichment based. So these are things like employment agencies or resume building agencies, Michigan Works is a big one. I'm sure a lot of you are familiar with that. Education and life skills. Big one is Michigan Rehabilitation Services. And then of course, you're going to find some local ones as well. So again, understanding your community is essential. And then I think at the bottom of that list was churches, and I listed Habitat for Humanity. And I had a thought on this last minute. And I want to point out too that not only are we serving those like in early recovery, but we're serving those who are in long-term recovery, who may be in like the maintenance stage where they're doing well, right? And they got life mostly figured out, but places like Habitat for Humanity offer furniture and household things that are at a discounted rate, because there's this kind of phase in the maintenance stage where, it's not like you have a ton of money and you're trying to figure out what you're doing. So agencies like this are absolutely awesome to have in your pocket because everybody's needs are different. Other agencies that we work with just to conduct the basic RCO operations, places like health departments, criminal justice agencies, so your local sheriff's office, your city police department, your county jail, other county departments, which are huge, parks and recreation. A lot of our community events are hosted at city parks. So having the relationship with the individuals working there is imperative. School systems and again, other RCOs. I cannot tell you how critical the assistance and the relationships with other RCOs has been for me personally and Raw and all of our success that we're experiencing right now. So we're dependent on each other for all the resources, referrals, collaboration, training, education. And of course, we have different types of businesses that we work with in the community, right, to make our activities possible. So these are anything from movie theaters, bowling alleys, gyms, go-kart courses, putt-putt golf. We use gas stations a lot for Narcan distributions and passing out information. So those community supportive businesses are also essential. And then on more of the business side of it, just for direct operations, marketing agencies, newspapers, restaurants, t-shirt printing, attorneys, accountants, phone, cable, and internet. These are all not just businesses that you'll require services from to run your RCO, but you never know who you're going to run into that wants to help contribute at a different level, who wants to hear your story or the story of your RCO. And then last but not least, getting to our local leaders and elected officials, your district state reps, your district senators, your county commissioners, sheriffs, city council, chief of police, directors and CEOs of other partner agencies and boards. So becoming involved in this more political arena, while recovery is not a political thing, these are the individuals who have the power to make decisions, and you want them on your side to drive the success of your RCO and help as many people as you possibly can. So local leaders and elected officials, the relationship building behind that is essential. I found a lot of support with our local state representative. He's currently going for the state Senate position, and we are very blessed. He is a person in recovery himself, and he speaks openly about that. So we are in a very good position with that here in Monroe. And we use this to elevate the voice of the recovery community, to build the credibility for your RCO. Like Deb said, we're the new kid on the block, so building that credibility is important. And then last but not least, and usually everyone's least favorite topic to talk about is the funding opportunities, right? And as much as a lot of folks don't want to have this conversation, it's we need the money to run the business, right? To help the people. So with that, I just want to say thank you to everybody for listening and being on this webinar today. And I'm going to pass it to Ricardo.
All right, well, thank you, partners. So yeah, my name is Ricardo Bowen. I'm a person in long-term sustained recovery. What that means to me is I haven't used any drugs or alcohol purposefully, none, for the last 25 years. And the wonderful thing about that is it's allowed my life to become purposeful, meaningful. I get to go to bed at night. I don't hold my head down in shame. And part of what it's also allowed me to do is to be in a position to help a lot of other people find their way to better living, improve health, move away from active illness, and find a healthy living. Just like so many people did for me, who were patient with me for a lot of years before I was able to get stable and stay stable 25 years ago. So I really am passionate about the work that we do. I'm passionate about recovery coaching. And part of my journey over time has led me to become the director of Peer 360 Recovery Alliance, which is a recovery community organization in and around the Thumb area and the Saginaw Bay area in the state of here in Michigan. So my presentation is focused on funding and funder relationships. And I don't claim to be like a funding guru. However, I do have experience. And I was actually share in a very modest way, a humble way, that organization has had success in terms of growth and funding growth, funding sources. I also want to credit the people that do fund us. They are committed to the utilization of people in recovery to help other people in recovery find their way to healthier living and sustain long-term recovery. So I want to just say that about the people who are behind us with funding, that they are well-intended and they get why it's so important that those of us who have this lived experience are there to help other people. So real quickly, Peer 360 Recovery Alliance, there was some initial activity in 2013, 2014, where we started a strategic planning process to kind of look at what is a recovery community organization, and then what that might look like in our region. And that consists of people in recovery, recovery allies, individuals who cared about making sure people had a better chance of being successful in overcoming substance use disorder. At the very beginning, we did achieve a 501c3 status. We actually got it in April of 2016. We started doing that work in 2015. We got a 501c3 status in 2016 in the month of April. At that time, we had one source of resources to support us. And since that, by the way, from 2016 to now, our budget has grown tenfold. We have 10 more times more than money coming in our doors this year than we did back in 2016. We also have multiple streams of resources now. Our PIHP, our regional coordinator, Mr. Health Network, we've been fortunately we have had some success with the state of Michigan, the peer supports and peer support expansion grants that have come out in the last couple of years. We've had some success there. We also have had some success with foundations, and we have some other smaller relationships with individuals, organizations that want to utilize recovery coaches, but don't quite know how to manage all that. So they connect with us to do that. We have to, and those are all in letters of understanding and memorandums of understanding, and they are, and it does inform and help to grow our budget and expand our sources. So I want to start off by saying, with regard to attracting funding and having relationships with funders, I believe the first place to begin is you got to figure out how to make your case in advance. Before you ever knock on the door, you should already be doing the legwork to prove that you have reach, that you reach people, that you do services, that people like what you do, and you do that in a very purposeful way. And so you want qualitative data. You want, and which is like numbers, you want qualitative data. How good do we really do this stuff based on the people who come and talk to us? And you also want to collect stories from people. And I'll say more about that in just a moment. So when it comes to quantitative, you want to be collecting real basic stuff, like how many categories of service do you do? I heard Sarah mention it, and Chris talked about the different kinds of programming that they do. And so you want to count how many kinds of services do we do? In the activity that we've given, how many people showed up? So when people, you don't have to get names when people come in, but you can certainly have people kind of put the initials down and count them, right? Make sure you count all the children that come through. Don't miss a soul. And everybody signed in, right? So you can count how many people actually showed up. So when you go to funders, you can say, we had these many activities and we reached these many thousands of people and we don't even have funding yet. What can you imagine we could do if we had some resources to back us up? How many hours of service are you providing? How long are you all out there doing what you do, start to finish? Capture those hours. How many, Sarah mentioned the utilization of volunteers. Kind of catalog, how many volunteers do you have? And if you get, and if you want to be really highfalutin, categorize how many hours of volunteer service did you get as well? Because that's also an impactful statement when you go to ask funding. Because it's almost like an in-kind contribution to the funder source. Anyway, so you want to capture those kind of things, and then capture some basic demographics. You don't have to get all too deep in it, but how many people are male, how many females? If you can find a way to capture race and ethnicity, people who come to your groups, you want to be able to show, particularly if you are reaching diverse populations, it's important that we let funders know that because so many populations are underserved. And to be able to say there are underserved populations that we are reaching, and we can do a better job if we have more to the funding to do deeper work. And like I said before, count adults, children, where do people come from, what cities are you serving, what's your reach? So you're able to make those kinds of statements when you reach out for funders. And the other thing that allows you to do, if you know what your reach is, it also help you target which funders to go after, right? So if you do a lot of work, say, I don't want to, in any one particular county, there may be a foundation source in that county, and you can say, in this particular county, these are number of people we are already reaching. We need more resources. We can do this work better and have a greater impact. And then you want to make qualitative statements. Do satisfaction surveys. Take the time to do that. Run around your events in the middle of the events. And do a raffle. If you fill out this survey, you can get in this raffle and get a gift card, and people to sign them, and then we'll ask them, what did you like, what did you not like, what else do you want to see us do? And it doesn't have to be extensive, just some basic questions. Would you like to come back to some of these again? Did you get enough food, right? Did you have a good time? Did you feel safe here? Just basic questions, nothing real deep, but it does speak to you're inquiring about the people you serve to evaluate you. And that's an important piece of being able to establish your credibility when you seek funding from funders. You can do focus groups. We are very, very successful, like in Native American community, for instance, where our very first activity we did was we convened focus groups and asked the people in the community, how can we be of use? How can we build on what's already here? And we got that information, So as we built our programs and saw funding, we were able to say, this is what we plan to do. And we're going to do it because the community said to us, this is what would work for them, right? And then personal impact statements. It's been real interesting for me. I didn't realize to what extent how powerful this is. When we do this work, a lot of us have we interact with somebody and we see things get better for them. They tell us how much they appreciate the fact that we spent time with them, or how much they just really are so glad that they're able to bring their family and their family connecting with their family. And I phased through drug court. I couldn't have done it without you. All of that, and that gives us a sense of pride and purpose, right? Well, our funders don't get to hear that. They hear from us. So if you got impact statements where people say, This is how this service impacted my life. This is what it has done for me and my family. Get those. Ask permission to use them. And if you are really got it going on, you can do it in video format. Of course, with permission and all that. But getting written stories and offer that to the people that you're seeking funding for. And once you do get funding, share those stories with the people that are funding you. So because they too are just like us. They really want to make a difference, yet they don't get to see that difference from where they sit. So we want them to see that difference through some of these impact statements that we collect. So collect those stories and be purposeful about that. It really does make a difference in the quality of your engagement with funders. It has been for me. Let me share about our organization. That has been that way for us. It's important that you understand your funders' priorities. I have a kind of an old school saying, my boss's priorities are my priorities. If I follow along with my boss, we're probably gonna get along okay. But know what the funders' priorities are, because they have pressures too. They have purposes for the funds they come in to them. So if you can understand what they really need, particularly if it aligns with what recovery coaching and what our missions are all about, that's value added. So understand what their priorities are. I would also say, though, it's really important to really try to avoid doing the money chase. Just because there's another funding stream out there and it may be, and don't just jump at it. Because part of what can happen, we can start getting so much money in and commit to do all these different things, and we don't have the foundation or the readiness to do them well. So ultimately, we start to fail as organizations. Also, if we do the money chase, you may also wind up moving outside what is our real core and what is the fidelity of recovery coaching. We are the only folk who stand in the gap to serve people in recovery and make recovery easier for people to find and easier for people to stay in for the long term. We are them. We are that category. Other folks do other stuff, let them do it. I personally believe in our organization, we want to stay focused on making sure the work we do is in the heart and soul, is how do we help people in recovery find their way and stay. Also, in our organization, a lot of times I know some organizations are built to do prevention work and they have, education classes, those kind of things. And they're purposely built that way. Our organization, we are laser focused on doing recovery services. Now, we certainly engage in prevention, support prevention efforts, and all of that. However, our organization really seeks not to, because there's a new evidence-based prevention curriculum that you can get it and you can get funded to do it. And so now you got more funding, we just don't do that because we want to stay true to coaching and have fidelity to coaching. That's our organization. Again, there are other organizations who are built to have that larger array. So just be careful about trying to get too far. We want to stay in our lanes, don't get too far out of our lanes. You don't want to undermine your usefulness and your credibility by doing things that you really aren't prepared to do. All right, so that's just my little caveat about that. So stay in our lane. When it comes to interacting with funders, be transparent. Difficult things are going to pop up. We started this work, and there were a lot of things that we wanted to go out there and do some groups and help some people, right? And that's what we started. We had a coffee pot, had a place, a few people to do some meetings. Went out there and had some events. We weren't as we started to grow. Real things happen. People do people stuff. And so we were in a situation where you have to let people go sometimes. And then we had an individual who we legit had all over an abundance of legitimacy to disengage from employment. We never like to do that, but sometimes you just have to when ethical boundaries are so terribly violated. We just have to do that to protect the organization, to protect the people we serve, and to protect the profession. This individual was not willing to own up to that person's part and went on this rant behavior all over Facebook, all over just all kind of stuff. And so what we did was, I did not want our funders to be blindsided by all this vitriol out there in the world. So we went directly to them and say, this is what is happening. I want you to know ahead of time, this is the circumstance. Here is out here. We in those situations, we don't tell the public outside the street, right? Because they cause us too much confusion and we don't want to breach confidentiality. But with our funders, we were able to say, here is the story, this is the why. So I want you to be aware of that because it's going to come at you. We don't want you to be blindsided. The other thing too is, as we do this work, sometimes things are going to go awry. We're going to make mistakes. We just are. We're not, we are new to this. We continue to grow. We morph and change, and we're going to make some mistakes. And when things go awry, don't try to obfuscate and try to act like, oh, well, maybe I thought it was this and it looked like that, and y'all got it wrong, and or whatever. We had a situation like some of you all were around when the SOR funding came down the pipe, and it was a scramble. And our organization funded us, really wanted us to do some expansion and saw an opportunity in SOR. And later on, though, as SOR became more scrutinized, the question became, are you really doing what SOR is intended for? And the answer was, no, we're not. Didn't want to say that. Not to be purposely put off base. It's just that when it first started, we went down the track that later on became not okay. And rather than say, well, we kind of do it, we kind of don't, I think we okay. We just said, here's what we do. This is what we do. And our understanding right now, it doesn't fit. So where do we go from here? So don't obfuscate. A lot of times what we want to do is kind of hide, because of embarrassment and feeling humiliated and all that stuff. Don't do it. Just be transparent, be honest, don't obfuscate. Integrity is so important, and particularly with our funders. With everybody, all the work we do, we have to be integral. And I have found that the people who fund us and the people who work with us have consistently responded to our integrity, even when we had to have a sanction. But integrity matters. We also, regarding funding, just want to make some comments about how important it is that you have reputable accounting. We made a choice along the way to actually have a recovery, an ally in the community, has a lot of experience with substance use disorder, accounting, and fundraising and grant writing and all of that. And that has been a value-added choice. As we grow, it becomes more and more complex. The scrutiny becomes greater. And understanding that and managing all that is a lot more behind the scene than meets the eye. All of a sudden, you get audits. There's IRS audits and there's CPA audits, and out the blue, the funders will come through for an audit. And then managing that and talking that lingo and putting all that together, you want somebody who knows. We chose to have someone who understands all that. Now we are in that mix with them. They don't do it without us, but their guidance and their understanding and their ability to talk that lingo and manage those forms and those processes is extremely valuable. There are so many things that have popped up, government requirements. I didn't have any idea about, what do you do about workers' compensation and all of that kind of stuff. I started getting letters about after people who weren't with us anymore, they filed for workers' compensation. I started getting all these letters and all that. I'm like, I don't know what to do with all this stuff. However, our ally and our partner knew, and that made that stuff simpler and cleaner. And we had to run around wasting a whole bunch of time and making errors. The other thing too is, along the way, there will be unexpected changes with funding. With COVID-19, some of you may remember that there was a reduction in block grant funds to our state. That translated into a reduction in block grant funds to our funders, which translated into a midstream reduction in our funding. And so now you got to go back to the table, rearrange, figure all that stuff out. That is not an easy task to do. There's a lot of complexity behind that. And so having reputable accounting and have an ally that you can have a conversation with who will and develop an open communication so they really understand what we're doing and so they can support us in that accounting world. Because sometimes what we want to do and what the accounting principles say you can do don't always match. And so it's really cool to, to have a relationship with somebody you can be honest with and who will work with us, to make sure we get the resources we need and stay in good standing. That's the last thing I want to say too is important. Please, we always be talking about sustainability, growing the capacity of people that we work with. One of the things that we did in our organization when the MDHSS started with the a couple of years ago offering peer support expansion grants. I personally have a lot of background before I came here in grant writing and administration and such. None of my other staff have a clue about all that. However, for sustainability, they got to get a clue. So we have built a team of people. They have learned, we've gotten better, and collectively we've been successful. And the growth that they have gotten, the sense of self-efficacy that's come from that is beyond measure. And it speaks well for sustainability of our organization when I transition to wherever I transition, whenever that happens to come along. And if you got somebody on your board who's like really hot to trot about fundraising, latch on to them, right? There are people out there, there are allies out there who like to do that stuff, who are good at it. Let them help you, reach out to them, make them part of your fundraising and financial team. And that is the end of my presentation. Again, thank you all for listening.
Thank you so much, team. Thanks, Ricardo. And for our participants, we have a few minutes for questions and answers. Hopefully we can give you the right direction or not, but I do want to once again thank our colleagues, Chris, Sarah, and Ricardo and myself for participating in this. I hope we gave you a broad enough look at all the different aspects of the RCO process. So the floor is open, just unmute yourself. It's hard for us to see who might be raising their hands. So if you could just unmute yourself, we'll kind of do the cacophony thing. And if it gets to be too many, we'll take you one at a time.
But I will say one thing, if you use the reaction button and raise your hand, you will be in order of hand raised. If you can use the reaction button, you got to do that. Reaction button, raise your hand, we'll know what order the hands go up.
See, he's more clever about this than I am. So. I want to give you all support that we meet monthly. The MRCC meets monthly. It is a by membership group. If you are a member of a state RCO or what we would call an RCO-like community, you can feel free to email me at debsmith@wellmanx.com. I'll put that in the chat. We'll make sure you're the membership committee so that they can tell you how you can get involved. We are definitely, we have 10 RCOs that are actually from Faces and Voices, SAMHSA. We have actually 10 in the state. We want to double, triple, quadruple that because every county in the state needs to have some organization that's specifically representing recoveries. And yeah, if the rest of my team want to put their emails in the chat, Chris and Ricardo, I'm from the Lansing area. Sarah Derigo is from the downriver. Is it? No, you're from south, right? Sarah, where are you from?
Monroe County. I'm very close to downriver though, so you weren't too far off.
It wasn't too far off. Chris is from the Ann Arbor area. Ricardo's up north, up in is it, you're above, you're not Genesee. How far up are you, Ricardo?
We are Bay, Midland, Aranac, Shiawassee, Tuscola, Huron, Saginaw, and Midland.
Oh, great, Valerie. So let us know if you have any questions. We have a couple minutes left. Or we can just hang around if you have individual questions for any one of us, if you want to get on to the next meeting, but we'll be here to answer any of your questions. Well, you're welcome, B. Murphy. I did see Sarah Schrotka here for a second. Is Sarah still here?
I don't see her anymore.
Yeah, I was just wondering, like, how do we do?
Looking for feedback already, Deb. Well, I think you all did fantastic.
Yeah, you guys killed it. Thank you.
Well, you set us up perfectly, Chris. And
Yeah.
Ricardo is great.
I was gonna say Sarah texted me during the whole thing and was saying we did a good job, so I'll say that.
Okay. We all wanted those that love it.
Yeah, she also texted me too while you were speaking, Ricardo. She was like, "We got to take some of that idea right there for that specific slide where it was talking about the God, what were we just talking about? Oh, the qualitative data and whatnot.
I'll be right back.
That feedback from our not volunteers, but participants. I think we always get people that come up to us afterwards and talk about how impactful it is, but really getting that down would be great. So.
One thing I did not say in that too is it's also important that we evaluate the service deliverers. So when you do a group or event, get people to give us feedback, and we can evaluate one another on our skill sets to have that in the bank as well. Because you know what I mean? So that,
yeah, absolutely.
Because it speaks to the organization working, trying to be the best it can and as solid as it can. So all that is important.
Mm-hmm.
And I want to add too, if you're not familiar with your local RCO, reach out, seek them out, go check it out. RCOs are amazing. And I'm not just saying that because I work in one.
Yeah. And really, we represent just 4 types of RCOs. I mean, some of us are small, some of us are big. I loved what Ricardo presented about, staying true to yourself, staying true to your mission. So if there's anybody in our room right now who has like a real passion to want to further the work of RCOs, still don't hesitate. We're all really approachable. We're all recoveries, for goodness sakes. We're all trying to help each other. So don't hesitate to reach out and figure out, as an individual, how to plug in someplace. We are good at helping folks navigate. That's the work, right? So we want to make sure that everyone has an opportunity. And if you represent an agency and you're coming away from this conversation today saying, wow, this would be so helpful for the people we serve. This would be something that would be, really beneficial to the people we serve. Let us know so we can figure out how to plug your people in. Okay.